Rheumatoid arthritis is an autoimmune disease that can cause joint pain, inflammation, and damage throughout our body. The joint damage that RA causes usually happens on both sides of the body. Though there is no cure, early diagnosis and treatment can help manage symptoms and prevent permanent joint damage. Treatments work best when RA is diagnosed early, so it's important to learn the signs. RA is a chronic disease marked by symptoms of inflammation and pain in the joints. RA symptoms commonly affect joints in the hands, wrists, and knees, but can also affect tissues and organs throughout the body, including the lungs, heart, and eyes. Rheumatoid arthritis symptoms can include pain or aching in more than one joint, fatigue, tenderness and swelling in more than one joint, stiffness in more than one joint, same joint symptoms on both sides of the body, loss of joint function and deformities, weakness, low-grade fever, and loss of appetite. These symptoms can vary from mild to severe. There are a number of genetic and environmental factors that may increase the risk of developing rheumatoid arthritis. RA is an autoimmune disorder and is the result of the body's immune system attacking healthy body tissues. However, the specific causes or triggers of RA are not yet known. If someone have RA, immune system sends antibodies to the lining of the joints as part of the disease process. These antibodies attack the tissues lining the joints, causing the lining cells to divide and contribute to inflammation. During this process, chemicals are released that can damage nearby bones, cartilage, tendons, and ligaments. If RA is not treated, the joint will become damaged and lose its shape and alignment, eventually becoming destroyed. Risk factors for RA include age, sex, genetics, smoking, obesity, history of live births, diet, and early life exposure. There are several different types of rheumatoid arthritis. Number 1. Seropositive rheumatoid arthritis. If someone have seropositive RA, they have a positive rheumatoid factor or anti-CCP blood test result. This means they have the antibodies that cause their immune system to attack joints. Number 2. Seronegative rheumatoid arthritis. If someone have a negative RF blood test result and a negative anti-CCP result, but they still have RA symptoms, they may have seronegative rheumatoid arthritis. Number 3. Juvenile idiopathic arthritis. This refers to RA in children ages 17 years old and younger. The condition was previously known as juvenile rheumatoid arthritis. The symptoms are the same as those of other types of RA, but they may also include eye inflammation and issues with physical development. Diagnosing RA can take time and may require multiple lab tests to confirm clinical examination findings. Healthcare provider first ask about symptoms and medical history. They'll also perform a physical exam of the joints. This will include looking for swelling and redness, examining joint function and range of motion, touching the affected joints to check for warmth and tenderness, examining for skin nodules, testing the reflexes and muscle strength. Since no single test can confirm a diagnosis of rheumatoid arthritis, healthcare provider or rheumatologist may use several different types of tests. There are several types of blood tests that help to determine rheumatoid arthritis. These tests include rheumatoid factor test, anti-citrullonated peptide antibody test, antinuclear antibody test, erythrocyte sedimentation rate, C-reactive protein test. They may also request certain imaging tests, such as an ultrasound, X-ray, or MRI. Having RA can put you at an increased risk of developing other health complications. Some people may also develop complications from medications used to treat rheumatoid arthritis. Complications of RA include premature heart disease, interstitial lung disease, carpal tunnel syndrome, pulmonary fibrosis, chest pain, eyes conditions, vasculitis, cervical myelopathy, pneumonia, joint damage, renal failure, pancytopenia, lymphoma, subcutaneous nodules, and gastrointestinal hemorrhage. There's no cure for RA, but there are effective treatments that can help to manage it and prevent damage. Treatments for RA help to manage the pain and control the inflammatory response. In many cases, this can result in remission. Decreasing the inflammation can also help to prevent further joint and organ damage. Treatments may include medications, alternative or home remedies, dietary changes, and specific types of exercise. There are many types of medication for RA. Some of these medications help to reduce the pain and inflammation of RA, others help to reduce flares and limit the damage that RA does to the joints. Non-steroidal anti-inflammatory drugs, corticosteroids, and acetaminophen medications help to reduce the pain and inflammation during RA flares. Disease-modifying antirheumatic drugs, biologics, and Janus kinase inhibitors work to slow the damage that RA can cause to the body. Certain home remedies and lifestyle adjustments may help to improve the quality of life when living with RA. This includes regular exercise, get enough of rest, apply heat or cold, and try assistive devices. Alright, it's all over about rheumatoid arthritis. Thanks for watching.